Yes, and the doctor is in today. And you know, one of the topics that we're really going to focus on, because this is something that's been in the news a lot, brain tumors. And that's because singer Sheryl Crow, she announced last week that she had a benign tumor. Crow had an MRI after she forgot the lyrics to one of her songs while performing at a concert. So if you forget some things that you normally would not forget, should you be worried? Should you be consulting your doctor? So joining us today is Dr. Scot Ackerman. He is one of the First Coast's leading oncologists. He is here with us every week to discuss a variety of health topics. And today's topics, brain tumors, very scary. And when this stuff kind of surfaces in the news, you think to yourself, should I be concerned? Should I be worried? But you know what, knowing the facts and knowing what
you should be.
No, you should. Well, you should be concerned about, you know, something as simple as forgetting, you know, where I left my keys, or when I walk into another room, you forget why you went in there. Is that a reason for concern? And let's start off though with Sheryl Crow though, because I think that's important to put this all into perspective. What kind of brain tumor does she have?
So Sheryl Crow, as we heard this week, announced that she had a brain tumor. And what we know about it is it's called a meningioma. A meningioma is generally a benign brain tumor, and they're fairly common. There's about 6,000 or so diagnosed every year. Now, when you think about brain tumors, everybody thinks, oh my God, I have cancer in the brain. But not all brain tumors are cancerous. They're not all malignant, but many of them are. Most commonly, the most common tumor in the brain, if you have a brain tumor, in fact, is a tumor that's spread from some other part of the body. Within the brain itself, though, we have lots of different kinds of brain tumors, over 100 brain tumors that begin in the brain. And of those that begin in the brain, many of them are benign, like the meningioma. And meningiomas account for about a third of tumors in the brain. The interesting thing about meningiomas, as opposed to some of the other brain tumors, is that it really doesn't begin within the brain tissue itself. It begins in the lining of the brain, or the tissue that surrounds the brain where the fluid, the spinal fluid is in. And that's called the meninges. And so you can get tumors growing from the meninges, hence the name a meningioma. And that's what Sheryl has.
Right, and obviously if you do have a brain tumor, this is a very serious thing, as I just said at the top of the show. Listen, her tumor is benign. A lot of people hear that. They might not necessarily know what the definition of benign is. What does benign mean?
So in our bodies, when we have tumors, whether it's the brain or anywhere else in your body, we can have benign tumors or malignant tumors. So benign tumors could be a cyst in the kidney. Women get benign tumors of the uterus all the time. We call them fibroids in the uterus. We have benign tumors of the breast, fibrocystic disease, or benign tumors in the breast. But other tumors are malignant, and malignant means cancer. So malignant tumors are cancerous tumors. So benign tumors are characterized because they grow slowly, they don't spread, they don't go to any other parts of the body. Whereas malignant tumors, they have the capacity to spread unchecked and also to spread also to go to other parts of the body.
Yeah, and so we were talking about, you know, the symptoms. If you walk into a room, you forget why you were originally going there. You can't find your car keys. I mean, what are some of the symptoms that are associated though with brain tumors?
So whether the tumor is benign or malignant in the brain, the symptoms are very similar. So that's what makes us real scared if we have symptoms associated with a tumor in the brain. God forbid it's a malignant tumor. So the symptoms to be concerned about are headaches, could be seizures. Depending on where in the brain the tumor is, you can have changes in sense of smell or vision. You could have forgetfulness in other parts of the brain, which is what happened in Sheryl Crow's case.
Yeah, and so how are these tumors then diagnosed?
So if you have any of these symptoms, and you didn't have them before, so if it's a new thing that you're becoming more forgetful than you were before, like in Sheryl Crow's case, you just see your physician. And when you see your physician should get a good history and do a good physical examination, because certainly if you've had a cancer or something else that is found in your body, that would help us to understand what's going on in your brain.
And she had breast cancer beforehand.
Right, exactly. And so the fact that she had breast cancer before, the first thing we think about in someone with a history of breast cancer where they're having some sort of changes in their cognitive function is that maybe the cancer from the breast spread to the brain, because it's a common thing with breast cancer. But we do tests of the brain to see exactly what's going on. We could do an EEG, which is an electroencephalograph, where we look at the electrical waves in the brain, a CAT scan, which is like an X-ray of the brain where we can see structures, and an MRI, which allows us to see deep into the brain as well. Ultimately, however, a biopsy frequently will be what's used to know what kind of tumor it is.
We have about 30 seconds left. What's the treatment then if you're finding yourself in this situation?
So brain tumors are like cancers, like any cancer in the body, where our treatments could be surgery or chemotherapy or radiation. Benign tumors, though, and we could tell frequently if they're benign just by the x-rays. Frequently we decide on the benign tumors to leave them alone and just watch and wait, because they may have been there for 20 years and they may not grow very rapidly. But the treatment needs to be tailored to the tumor and the person. It could be nothing, just watch and wait. Malignant tumor, however, you may want to do surgery and radiation and possibly chemotherapy.
Okay. All right, Dr. Ackerman, thank you again for giving us
Casey.
perspective and insight on all of this stuff, especially when we see things unfold in the news. It's nice to get our answers from the experts. So thank you. We appreciate it. We want to thank you also for sponsoring the segment. Dr. Ackerman is with us every Friday. He's going to be here next week talking about thyroid function. For questions, if you have any regarding this topic or any other health questions, you can go to firstcoastoncology.com, confidentially submit your questions to Ask the Doctor.